Welcome to Professional Certifications channel. In this video, we're covering Chapter 2 of the ICD-10-CM, which focuses on neoplasms, with codes ranging from C00 to D49. If you're studying for a medical coding exam or working in oncology, pathology, or general practice, this chapter is crucial. Let's get into it.
Section 1. What are neoplasms? Neoplasms are abnormal growths of tissue that may be benign, non-cancerous, in situ, malignant, cancerous, or uncertain/unknown behavior. ICD-10-CM organizes neoplasms by anatomical site and behavior. There are 5 behavior categories. 1. Malignant Primary, C00 to C80. 2. Malignant Secondary, C77 to C79. 3. In situ, D00 to D09. 4. Benign, D10 to D36. 5. Uncertain/unknown behavior, D37 to D49.
Section 2. Malignant neoplasms. Let's break down malignant neoplasms, which are the most commonly coded. C00 to C14, lip, oral cavity, and pharynx. C15 to C26, digestive organs, includes esophageal, colon, liver, and pancreatic cancers. C30 to C39, respiratory, includes lung cancer, C34. C40 to C41, bone and connective tissues. C50, breast cancer. C53 to C58, female genital organs, includes cervical and ovarian cancers. C61, prostate cancer. C64 to C68, urinary tract, includes kidney and bladder cancers. C70 to C72, brain and nervous system. C81 to C96, hematological cancers, Hodgkin's, C81, leukemia, C91 to C95. Example: C34.90, malignant neoplasm of unspecified part of unspecified bronchus or lung.
Section 3. Secondary and other neoplasms. When a cancer spreads, it's called metastasis or a secondary neoplasm. These are coded C77 to C79. C77, secondary and unspecified malignant neoplasm of lymph nodes. C78, secondary malignant neoplasm of respiratory/digestive organs. C79, secondary malignant neoplasm of other sites. Example: breast cancer that spreads to the bone, code C50.X first, then C79.51 for secondary bone cancer. Other categories include: in situ, D00 to D09 early stage, localized cancers not yet invasive. Example: D05.1, lobular carcinoma in situ of breast. Benign neoplasms, D10 to D36 non-cancerous growths. Example: D33.3 to benign neoplasm of spinal cord. Uncertain behavior, D37 to D48 cannot determine if benign or malignant.
Example: D48.5, neoplasm of uncertain behavior of skin. Section 4. Key coding tips. Here are a few important tips for neoplasm coding. 1. Use the neoplasm table in the tabular index. It helps you look up by anatomical site and choose the correct behavior type. 2. Sequence the primary site first, followed by secondary sites. 3. If the primary site is no longer present due to surgery, use Z85.X codes for personal history of malignancy. 4. Use Z51.11 for chemotherapy and Z51.0 for radiation therapy when the visit is solely for treatment.
Section 5. Real-life scenarios. Let's see a few case examples in action. Example 1. A patient has primary liver cancer with metastasis to the lung. Codes: C22.0, liver, C78.0, lung metastasis. Example 2. Patient receives chemotherapy for breast cancer. Codes: Z51.11, chemotherapy, C50.X, breast cancer. Example 3. Benign brain tumor in the cerebrum. Code D33.0, benign neoplasm of brain, supratentorial.
Section 6, common neoplasm diagnoses to know. Here's a quick list of commonly encountered neoplasm codes. C34.90, lung cancer, unspecified bronchus/lung. C50.911, breast cancer, female, unspecified site. C61, prostate cancer. C91.0, acute lymphoblastic leukemia. D33.2, benign neoplasm of brainstem. D48.5, uncertain behavior of skin neoplasm.
And that's your complete overview of Chapter 2, Neoplasms in ICD-10-CM. Remember, always verify the site, behavior, and documentation before choosing the right code. Neoplasm coding requires precision, so practice using the Neoplasm table and know your sequencing rules well. If you found this helpful, like this video, drop a comment, and don't forget to subscribe for the next chapter on diseases of the blood and blood-forming organs. See you in the next one.